Welcome to the Doodoo Divas Smells Like Money podcast. I'm your host, Suzan Chin-Taylor, CEO and founder of Creative Raven, the firm that helps wastewater industry contractors and manufacturers unlock the power of digital marketing, AI, and PR to boost sales and opportunities. Whether it's through our online marketing and lead generation programs or providing a fully outsourced marketing department, we are passionate about helping businesses in the wastewater and civil infrastructure sectors not just survive, but thrive in today's digital world. Each episode, I'll be bringing you expert tips and strategies to help you grow and succeed. Let's dive in. Well, hello, everybody, and welcome to this week's episode of the Doodoo Divas Smells Like Money podcast. Today, we are visiting with a very unique guest from an even more unique and interesting company. And he is Darrell Moon, who is the CEO and founder of Orriant. Now, Darrell and his company are a little bit of an unusual guest for the show because they are not really connected directly to the industry, but they have something that I think will be of great interest to the people in this industry as something they might want to avail themselves of. Contracting companies, manufacturers, basically any entity that has people, and all entities have people. And because, this is such a tough industry to work in, that we want to take care of our people. We want to give them benefits that they're going to like. We want to keep them healthy. We want to keep them safe. And we also want to have a tool for recruiting the next wave of new people and just even retaining those who have joined us and not going on to what they might perceive as greener pastures. So without really giving anything of a spoiler, I'm going to let Darrell take it away. And so welcome to the show, Darrell.
Well, it's truly an honor, Suzanne. Thank you so much. And I've been excited about being on your show and just being able to share what I think will be very valuable information for anybody in the industry.
All right. So tell us a little bit about, just to frame it so that we have a benchmark for what we're going to be talking about. What made you, a little bit about your background and what made you start this company and what you felt its purpose was going to be, its mission?
So my career started off as a hospital administrator.
Okay.
And I had the opportunity and privilege of running 10 different hospitals all over the country.
Wow.
Mostly for the largest hospital system in the country. But I became very disillusioned with my own industry when I began to realize that here I sat at the top of the food chain in the largest industry in America, healthcare. And I literally got away with scheming against my customer every day. Ooh. And it didn't feel very aligned when I really stepped back and asked, well, what is the purpose of this industry? My job and the way I was rewarded was filling up my hospital beds. Mm-hmm. And what I got to do and what I did to fill up my hospital beds was not at all in alignment with the customer. And when I say customer, I'm talking about business leaders who go out and buy healthcare benefits for their employees to attract and retain good employees. I was completely misaligned with the very people who buy healthcare. Here I sat at the top of the food chain, and my job was to fill up my hospital bed when that was nothing to do with what the customer wanted. They just wanted me to be there, but most importantly, they wanted a healthy, productive workforce, right? Well, there was nothing in my job description that had anything to do with keeping people healthy. In fact, it was all about designing systems that really don't get at the root problem and just escalate people from primary care to specialty care and into hospital care. That's the way healthcare works. And I just said, I can't do this. So I left the treatment side many years ago to try to get upstream. And I have been passionate about showing employers who are the customer of healthcare, they wield all the power on how healthcare works, and yet they think they have absolutely no power against it. And I've been spending 30 years showing business leaders how they have all the power in the world. No one's ever showed them how to wield that power to get something better for their employees.
So enter Orriant.
Well, so I built Orriant as a personal success and health coaching company to help people get upstream and address behaviors that wind up resulting in bad health early on. 87% of everything we spend in healthcare can be traced back to behavior. But we don't put a lot of emphasis in the healthcare system on helping people change behavior. And so I decided to try to get way upstream and do that. And I had the opportunity to get in front of lots of business leaders. I'm the top speaker for the largest CEO coaching organization in the world called Vistage. And 6 years ago, I came across an enormous discovery. And all I do now is point business leaders in the direction of how they can have what I discovered. And what I discovered was that there actually is a healthcare system in the world that we can put on a pedestal and say, that's how healthcare should work. That's literally how all healthcare should work. And healthcare doesn't work like it at all. And if you want, I can tell you just a little bit about the story behind how it came to be.
Yeah, would love to know about that, because if this is a model, because we all look around the globe that it exists, we think, we're very afraid here of, I don't want to use the term, I don't want to get political, socialized medicine.
Right.
How what different forms of it in other countries, other industrialized nations have a form of it or a hybrid or have developed their own models.
Well, and it's not socialized medicine. It's really a different way to pay for healthcare. So
there you go. That's the difference. It's
exactly.
How are we paying for healthcare? And these models actually do work exceedingly well. That the patient's needs put above the insurance company's needs.
Or the hospital's needs.
Or the hospital's needs. So it is the care professional that's making the decision, and not, I hate to say this, but not a bean counter.
Yeah. So the way this amazing healthcare system came to be is that the federal government admitted that when they stole the lands of indigenous tribes around this country and gave them free healthcare in perpetuity in lieu of that, they actually did the indigenous people of this country a great disservice, because they acknowledged themselves back in 1980s that the federal Indian healthcare system was a terrible healthcare system. So they said to all tribes across this country, if you would like to leave the federal Indian healthcare system and build your own healthcare system, we will let you, and we will divert our money to you. And a group called the South Central Foundation, representing 190 tribes of Alaskan Native people, 70,000 people, said to themselves, well, we have the worst healthcare system in the world through the federal Indian healthcare system. Our population health scores are some of the worst in the world. We can't make this any worse than it is. Let's build our own system from the ground up. And they did something that no one had ever done before in building healthcare. They went out to their 70,000 customers and asked them what they wanted.
Wow, what a concept.
Imagine that. And what their customers said they wanted was, well, first of all, we don't want a paternalistic system that just tells us what to do and fixes us when we're broken. What we want is a healthcare system that's a guest at our table, that journeys with us on our journey through life, supporting us in reaching our dreams, goals, and aspirations in life. And we build a trusting relationship with people who are there to help us be successful in life. And when we fall off the cliff and get sick, we already know someone we trust that we can turn to, who will offer us immediate access to perfect care every time, coordinated at every level, supporting us in getting back on our journey to reach our aspirations in life. That is not how healthcare works. There is nothing about our current US healthcare system that looks like that at all. Well, they decided to build a healthcare system around what the customer wanted. And now, 30 years later, they are light years ahead of every other healthcare model in the world. Nobody can even touch them. I mean, we're talking about healthcare systems all over the globe who travel to Anchorage, Alaska to learn how to do healthcare. Wow. Singapore and the Netherlands are often thought of as the best country healthcare systems. They both went to Anchorage, Alaska to learn how to do it.
Wow.
When I met them 6 years ago, I said, this is amazing. Your outcomes are unbelievable. You have the highest level of customer satisfaction, 98%. There's no other healthcare system that's won the president's prestigious Malcolm Baldrige Award for Quality twice. You have. No one gets the level of population health improvement you've achieved or the outcomes, and you spend half as much on healthcare as the rest of us in this country. Does anybody ever come up from the lower 48 to figure out what you've done? Not very often. I'm like, okay, I am going to dedicate my life to sharing your story to the business leaders of America and show them how they can have the aspirational model that you have pioneered through their own health benefits plans. And we're doing that with large employers, small employers all over the country. We're simply showing business leaders how they have all the control in the world. They just don't know how to wield it. And we simply show them how to wield that power as the customer to offer their employees much better healthcare at much better price. I mean, who wouldn't want, what business leader wouldn't want to offer their employees the best healthcare model in the world at half the price? That's a no-brainer.
Interesting. So with that and that story that you just told is that, we think that we're locked into only what they're offered with the big companies, the Blue Cross, the Blue Shield, the United Healthcare, the, Humana, whatever it is that's out there. And so I guess what you're alluding to is this actually replacing an employer having to go and buy a group plan through one of these big mega ones that we're so familiar with. They're all household names, but actually be able to get something that's going to be accepted by the medical community, not deny claims, but you're not locked in. So I'm sure that's running through everybody's mind. Well, okay, they've got this, but is my doctor going to accept it? I love my doctor. I don't want to change my doctor. I have one hospital in my community. Are they going to say, no, you can't come here because you're part of this system? So I'm sure these are all the questions that are probably running.
So let's start with how business leaders can wield their power, because that's the first thing that people don't know. When I get in front of 15 or 20 CEOs and I get 4 hours with them, I love to ask them why they buy healthcare. Why do you even offer this benefit in the first place? It's often your second largest cost of doing business. So why are you doing it? And when they peel back the onion and they really think about it, there's always one answer: to create loyalty amongst my employees, to attract and retain top talent. And then I asked them if they think that Peter Drucker was right when he said that which gets measured gets managed. And they all say yes. We have dashboards to run our company from here to there. And I say, okay, have you ever measured how well the second largest cost of doing business, buying healthcare benefits, is working to drive loyalty amongst your employees? That's not a hard thing to measure. And I never have heard any business leader that said that they're doing that. And I say, that's where the fumble starts. We never even define the business objective for why we're spending the money. We do it because we think we have to, but we never define what we really want, and we never measure to see if we're getting it. And then worst of all, we never align anybody to help us get it. I love to ask CEOs, does your salespeople get incentives to bring in more sales? Well, sure. Does your COO get incentives for creating greater efficiency? Well, sure. How many of you have ever rewarded or even recognized HR, who you put in charge of this enormous expense, for getting higher loyalty? Nobody ever does it. And then I say, why shouldn't you? If this is what you want, why shouldn't you be rewarding the people who are in charge of buying it so they get more incentive to give it to you and actually measure it and compensate them based on it? And then most importantly, what does HR do to buy healthcare? They simply go out and they find the big name brokers and they sign a broker letter of record. And that broker then represents the healthcare system to them. And I say, okay, is that broker ever compensated to improve loyalty scores? Never. In fact, that broker is aligned and they make more money as your costs go up and your loyalty scores go down. It's like there's no alignment between the very people you ask to be your advisors on what to buy and how to buy it to give you what you want. There's the fumble that has created now the largest industry in America that is completely out of control. In fact, I call the US healthcare system the world's largest cartel.
Wow.
It's a legal cartel, but it kills more people and steals more money out of people's pockets than all the cartels combined. And it's because the people at the helm who are spending the money are not aligning the system to give them what they want. It's that simple. Now, once you make that alignment, and that broker is actually incentivized to help you bring what you want to the table, the windows of opportunity unfold. And you can build one of these aspirational healthcare models anywhere in the country for a small employer or a large employer. You just need a creative, aligned broker who's aligned to make more money when you get what you want. And there are many out there. But if you go to the big houses and say, well, here's the big brokers in my community, I want you to do this, they'll probably not even be willing to align with you because most of their revenue comes from the insurance companies who give them rewards and overrides at the end of the year to keep everybody in the broken system. So you almost have to go outside of the big name brokers and work with people who are innovative and who have left the big brokerages and realized that their client is really the company, not the insurance company that's paying them commissions. And they sign a contract with the company where they're getting paid a fee and they strip out all commissions from all products and their incentives are tied to the employer reaching their business objectives. Makes all the difference in the world.
So in a way, you're almost creating, maybe I'm understanding this incorrectly, maybe I am understanding it correctly, you're almost creating your own healthcare plan that's catered to your needs instead of having to fit into the box that the Blue Cross Blue Shield or the Aetnas of the world are offering you to offer to your employees.
Right. Well, and you brought up a really important point, and that is, are my employees going to want to leave their current providers?
Yes.
Or their current hospitals? And I'll tell you, I'll share with you a case we just rolled out right here in Utah for a company of about 100 employees. And I'll show you how we were able to give them choice, but also encourage them to take advantage of this much better healthcare model. So here's an employer of about 100 employees, just under about 80 employees, spending about $1 million, facing a 22% increase through United Healthcare's fully insured plan. And it was a plan that was high deductible, which meant that the employee had to spend $3,000 of their own money before they even got any coverage. And to keep that ugly plan.
I would love to have a low deductible like that. Most of the ones when you're a small business, you're looking at 9, 10, 11,000 out of pocket deductible.
But this employer was facing about a $220,000 increase to keep that ugly plan in place.
Wow.
They just rolled out the 1st of January a new plan, an aspirational health plan that is guaranteed to not cost that employer any more money than they spent last year and could save them as much as $330,000. The employees saw a 40% decrease in their monthly premiums coming out of their paychecks. And the employees have access now to health care paid at 100%. No copays, no deductibles. They can have access to pharmaceuticals, even specialty drugs, hospitalization, all office visits at no cost. And 84% of those employees signed up to have a new primary care provider, leaving their old one, but now having a primary care provider who is going to be more available, who is going to take more time to figure out what the real problem was, who's going to be available 24/7 to be able to call on a phone and talk to someone, who is going to be willing to do a lot of healthcare over the phone, and who is really not going to have so many patients every day they couldn't give you more than 10 minutes. They're going to give you all the time you need. 84% were willing to shift away from their current primary care provider because they saw the benefits of having a concierge membership-based primary care provider. But we didn't force anybody into it. We just simply said, look, you can have a 40% decrease if you'll switch and have better care. And people said, you know what? I'll make the switch if it's a 40% decrease in what I have to spend on it. And you're giving me free care, not only for primary care, but all levels and medications. And we offered them, in addition to that, 24/7 access to a concierge nurse navigator who can answer all their questions 24/7, navigate them to the very best providers. We took away all network restrictions. They can go to any provider, and we're giving them access to the quality scores and appropriateness scores of all providers so they can find out who the best provider is, and they get access to all of that for no cost on them.
So it's not one of these where I want to go see Dr. Jones because I heard he's the best XYZ of this field for this problem that I have. Oh, well, Dr. Jones says, oh, well, that's great, but we don't accept your insurance. And then you're okay, well, then that means I got to go and pay the whatever he's going to charge me as a cash pay client if I really want to see him. So you're saying this model actually removes that friction point.
It does, and it leverages what you just said, and that is cash pay. So employees go to a provider, and when the provider asks for their insurance card, they say, I have insurance, but I'm going to be paying with cash today. Not with their personal money. They push a button on an app, it spins up a payment card, and they literally pay that provider with a card at the time of service with their company's plan money. And they're accessing care with the very best providers on a cash pay basis. That's why there's no network contracts. There's no need for network contracts. I can literally go to any provider in the country and simply pay with cash.
Wow. So you don't have to worry about those situations where, okay, I've got healthcare and I'm going on a vacation and I like to hike. And so I'm going on a vacation to Yellowstone and oops, trip and fall, and I have to go to a local hospital. I'm out of my state. Okay. So I'm not going to have that problem of, oh, well, you're out of network, you're out of state, but we're going to cover it, but only up to this amount. Or you're going to have this huge emergency room fee. Or it's like, oh, well, we're not going to cover that. We will cover this, but we won't cover that. And then here you are, you've gotten back from your lovely vacation with an injury, maybe in a cast, and now you're facing a couple $1,000 bill.
And now
it happened to happen, not while you were at home in your own neighborhood.
Right. It's leveraging cash pay. Hospitals and providers love cash pay because they don't have to wait 90 days to get their money. And so they're willing to give some of their very best discounts to people who pay at the time of service. And now these employees are paying at the time of service with their company's money through a payment card that they simply push a button and spin up a one-time payment card at the time of visit.
Wow. I'm sure we could have a whole nother episode about how this works when you have to do an in-hospital stay, but it sounds like it works on that same premise that you're not being locked in or handcuffed. You can get what you need when you need it and from whom.
And at a discounted rate because of cash discounts.
Right. So it's almost like when you look at a hospital bill that says, okay, this is what the hospital billed, and then this is what they accepted as payment from your insurance company and what the balance might be due to you. It kind of works on that same premise where it's because you're cash, I might bill $350,000, but because you're paying cash, I'll accept $75,000.
Exactly.
Basically it's that premise.
Well, let me give you an example. Here in Utah, where I live, the largest healthcare system is Intermountain Healthcare.
Okay.
And now that all hospitals across the country are required to put on the web all of their charges and all of their discounted contracts with all of their insurance companies, you can see what kind of discounts each hospital gives each insurance company. And you might think that the largest insurance companies get the best discounts. Well, that's a huge fallacy that people don't understand. Insurance companies only make more money for their shareholders when healthcare costs go up. So here in Utah, in Intermountain Healthcare System, their discounts range from 11% off of charges to 29% off of charges. And you would think that the biggest insurance companies get those biggest discounts, and that's not the case. In fact, their cash discount is 25%. So you get almost their very best discounts by walking in with cash.
Wow. Interesting. Well, Darrell, the wheels in my head are turning, thinking about, wow, I'd like to take advantage of this. And I'm sure anybody else listening is thinking, wow, how can I get me a piece of this? So let's close it with, if someone is interested in exploring the possibility of an aspirational healthcare plan for their employees, how can they get in touch with you? How can they learn more about what Orriant does and how they can begin the process of exploration and what is involved?
Probably the easiest.
Hack the power.
Yeah, probably the easiest thing to do is remember the words aspirational healthcare. Because if you go to aspirationalhealthcare.com, you'll learn all about this new model. You can reach us here at Orriant. If you want to go to Orriant, ORRIANT.com, you can contact us through there. But probably the easiest thing to remember is just aspirationalhealthcare.com.
And that will give you the basis for, what do I want to do and does this fit for me? Well, Darrell, thank you for, sharing this inspirational, aspirational healthcare model, because it is something I'm sure that very, very few people know exists and is actually available for them to implement. And they're probably thinking, oh, it's only for the big guys, but from what
No, we can help even the small employers with 1 or 2 employees.
Wow, that's amazing. That is absolutely amazing. Well, Darrell, thank you again. And we met on LinkedIn, great platform. And who would have thought that
Yep.
this would be part of the Doodoo Diva podcast? So again, thank you for coming on and sharing all of this insider information and your story and what is available to the industry. And audience, I hope you got something out of this and that you will take the time to explore this further for your organizations. And thanks again for tuning in. And until next time, keep it flowing. Thanks for tuning in to today's episode. If you're ready to take your marketing to the next level and start increasing sales and opportunities for your business, reach out to us at Creative Raven. We're here to help you thrive in the digital landscape. Visit creativeraven.com or click the link in the show notes below to schedule a call and learn how we can support your growth. If you enjoyed the insights on today's episode, be sure to hit subscribe so you'll never miss an update. Until next time, keep growing and keep it flowing.